Welcome back. It's 5:30. The Indiana State Department of Health announced today they will now begin offering booster doses of Moderna and Johnson & Johnson vaccines to eligible Hoosiers. Now, boosters are available to people who received Pfizer or Moderna vaccines at least 6 months ago and who are either 65 and up, and those 18 and older who live in long-term care setting. Also, those who have underlying medical conditions or Hoosiers who work or live in high-risk settings. Now, the J&J booster is open to everybody who got the single-dose vaccine at least 2 months ago. You can choose which brand of the vaccine you'd like to receive. And there is still a major push tonight for Hoosiers to get vaccinated. In fact, the CDC told us today 49% of Indiana's eligible population is fully vaccinated. But look at this. We are much lower than the 57% of the total U.S. population. So let's break this down a different way. Indiana there in blue, there are just 14 gray states with a smaller percentage of residents vaccinated. All those states you see there in green, including all of our neighboring states, have higher vaccine numbers. Vermont, Connecticut, Rhode Island, and Maine have 70% or more of their populations fully vaccinated. Well, experts say brain fog is now becoming a lingering symptom for people who have had COVID-19. In fact, in some cases, that side effect lasts for months, even for people who were not hospitalized. And there's a new study out tonight that looked at how cognitive impairment persists in COVID patients. Researchers performed a series of cognitive tests in more than 700 COVID patients who had no history of dementia. Hospitalized patients were more likely to have what's called brain fog, but nearly a quarter of those people had persistent memory problems. Those researchers said lingering memory problems in COVID patients could impact long-term treatment and have occupational concerns. More research, though, is needed to find out how COVID affects the brain. Pfizer said today its COVID vaccine is safe and 90.7% effective against symptomatic COVID in children between the age of 5 and 11. Right now, they're trying to get emergency use authorization for that particular age group. Pfizer shared the data in a new document ahead of a key meeting of the FDA vaccine advisors. They'll be meeting on Tuesday discussing whether to recommend authorizing the vaccine for kids under the age of 12.